Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh and good evening everyone. So we shall start our final keynote session. The moderator will be Dr. Siraj and the presenter will be Dr. Omar. I will pass the floor to
Assalamu alaikum wa rahmatullahi wa barakatuh. Yeah, brothers and sisters, we are waiting for the speaker, for the final keynote speaker to join us. He was in just now, but I don't see him here. We are waiting for him to join us, then we'll start, inshallah.
Right, sure.
Okay, Assalamu alaikum wa rahmatullahi wa barakatuh. Respected professors, colleagues, speakers, participants, ladies and gentlemen. Alhamdulillah Rabbil Alameen wa salatu wa salam ala Sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. We thank Allah subhanahu wa ta'ala for blessing us and bringing us this far in this conference. We have reached the final leg of the conference. We are having the fourth and final keynote addresses this afternoon, after which we'll have the closing, inshallah. Now, as they say, we have a khitam misk, we have the best conclusion, for the session, whereby we have our speaker, a distinguished professor of medicine, someone who is dear to us, someone who has been key in the process of Islamization from the beginning, actually, of the process of Islamization. He has been at the center of it. Right now, he's the Secretary General of the International Institute of Islamic Thought and Civilization. That is Professor Omar Hasan Kasule, a professor of medicine. His CV is really long. If I'm going to give details of all his qualifications, we'll end the whole hour in me giving you details. Professor Kasule is a medical doctor. He's a professor of medicine. He's a professor in charge of research and clinical trials in Asia, Middle East, USA. He's qualified from Makerere University, Uganda, and Harvard University. Professor Kasule was one of the founding team of the Kulia of Medicine in IIUM. He has since established many other faculties of medicine in Brunei, in Saudi Arabia, and he's involved in clinical trials and research and development. He's on a chairman of IRBs, that is institutional review boards in so many different countries, and he's has been in charge of approving hundreds or almost thousands of studies in clinical trials. He has developed curriculum for faculties of medicine in Saudi Arabia, in Malaysia, in Brunei, and is consultant to many international organizations and academic institutions. Professor Kasule is going to share with us his vast experience in the area of Islamization in general, and particularly Islamization in the Faculty of Medicine, where he has led and spearheaded efforts to train medical practitioners, medical lecturers to Islamize their disciplines and integrate them with Islamic knowledge. Without further ado, I call upon our respected, distinguished speaker, Professor Omar Hasan Kasule. Tafaddal mashkura. Prof.
Dr. Siraj, I don't think Prof. Omar is still in, but I just saw that he go out from the meeting. So sorry for that. I think we're still trying to reach him. Maybe a poor connection problem.
Okay, let me.
Dr. Isaac, I saw in room 2, there is a Prof. Omar Kasule, Hasan Kasule in room 2. Can you check in room 2, please? Breakout room.
Okay, we need some technical person to help us bring Prof back to the main room.
It's already in the main room. Prof, can you hear me now? Prof Omar?
Yeah, I can hear you.
Yeah, you can start the presentation, Prof Omar.
Yeah, thank you very much, Prof. Omar. We have done the introduction in your absence. You are in the breakout room. Please, could you start the presentation, Prof?
Okay. Bismillahir Rahmanir Rahim. Wassalatu wassalam ala Rasulillah. I'm very happy to be with all the brothers and sisters this afternoon. This is a continuing jihad, a continuing struggle to talk about integration of knowledge. We've been at this for over 40 years, alhamdulillah. It is still alive, it is still kicking, it's still progressing. I'll be talking to you about integration of knowledge in medicine. Now, medicine has got something different. Maybe because it is simpler, we are not talking about integration of knowledge as a project or as a hope. We actually have done it. It's practical. We can take you in a hospital and say, this is what we mean. So alhamdulillah, Allah is great. So what we mean by integration is putting Islamic values in whatever we are doing. Now, this doesn't mean that we are parochializing medicine or any discipline. It doesn't mean that we are creating something for Muslims and different from what is for non-Muslims. Integration means putting Islamic values because these values are universal values. So it applies to everybody. We are making better medicine. Now, in order for you to follow what has happened, let me give you a historical background. Before 1980, the concept of Islam in medicine was not very clear. But what happened, there were Islamic medical associations. Doctors got together and made an association. But when they made the association, they said, what shall we do? What's our mission? Now, they answered that question in several ways. Some of them thought that the Islamic Medical Association is just a normal association for just differences. The members are Muslims. But then the other doctors said, why are you separating from the rest of us? Some of them looked at the Islamic Medical Association as a forum for helping young doctors and students. Then ideas grew. They started looking at these associations as avenues for medical and relief programs. So this was a progress in the idea. Now, a lot of medical relief work was done by these associations. Basic motivation was Islam, and they saw that the outlet for this is going to be helping people. Eventually, Islamic medical associations of various countries got together and made the Federation of Islamic Medical Associations, which is the international arm. And slowly, some faculties of medicine started teaching Islam as part of the medical curriculum. YRC in Jakarta was doing that, and Azhar also in Cairo required you to study some things from Quran and memorize before you become a doctor. So that was in developments before 1995. At that time, there was a general return to Islam. People were asking themselves, what's Islam in economics, in politics, in medicine? So that was the time. So the idea kept on growing. In 1981, 1982, we met in Kuwait to try to see what does this mean, Islam in medicine. At that time, people thought that, well, we better go back to prophetic medicine. That's what it means, Tibb Nabawi. Some talked about the traditional medicine, Tibb Yunani, like the one that is practiced in India and Pakistan. But this paradigm did not last long because people were frustrated because they saw these are traditional medical systems. We have got scientific medicine. How do we merge the two together? Now, a breakthrough came in 1995 when we had a seminar in Malaysia at which we made a definition of what is Islamic medicine. And this is the definition that was elaborated, that Islamic medicine is medicine whose basic paradigms, concepts, values, and procedures conform or do not contradict with Quran and Sunnah. This was a breakthrough because this means that any system of medicine, be it Western, be it Chinese, if it follows the Islamic paradigms, can be accepted as Islamic medicine. And we got away from the idea that Islamic medicine is specific medical procedures. It also gave us the paradigm that Islamic medicine is something universal. Once we made this transformation, the movement grew very quickly because now things were very clear conceptually. So from 1995, Islamic hospitals and polyclinics were established. And then the question was, what's the Islamic paradigm in those hospitals? The first idea was to have an ibadah-friendly hospital, a hospital that helps the patient perform ibadah. Then we moved on to Sharia. We developed standards of a Sharia-compliant hospital. And there are many hospitals that were formed at that time, and I will be showing you some of them. With the development of the hospitals, also medical education from the Islamic perspective started. The pioneer was the International Islamic University in Malaysia. From 1997, our curriculum was integrated. We had fiqh to be as part of teaching. We included munakahat, muamalat, and things about fatwa on new matters in medicine. So we integrate the curriculum, and the students who graduated from this curriculum were different from doctors that before. So from that time on, we moved on, and then we started talking about Islamic medical ethics. What does Islam say about life support? What about genetic issues, genetic treatment? And starting in 2004, the idea grew wider when we introduced the theory of Maqasid Sharia as a guiding principle for all our Islamic hospitals and Islamic conceptualization of integration. Now I'll show you some pictures of the hospitals. As I said at the beginning, integration of knowledge in medicine is a reality. It's not a theory, it's a reality. This is the Islamic hospital in Amman, Jordan. This Islamic specialist hospital in Kuala Lumpur. Dr. Ishaq is there. This is the Islamic hospital in Bandung, Indonesia. This is Islamic hospital in Uganda. And this is the International Islamic Hospital in Yogyakarta, a big one, a modern edifice, very modern, on the paradigm of integrating Islam in medicine. We also, pari passu, developed several organizations. I talked already about Islamic Medical Associations, the Federation of Islamic Medical Associations. Then the hospitals also made a consortium. They made a group, and they meet every year to discuss how to develop integration of knowledge in medicine more. Also, faculties of medicine made a committee, a consortium, to meet on a regular basis so that they can exchange views about this. Now, this is a building of the Kuliah of Medicine in Kuantan, Malaysia, which integrates Islamic values. It's been doing this since 1997, and the curriculum is well developed, and they even have a hospital. They built a hospital. They said, look, we'll not teach Islamic medicine or integration of Islam in medicine, we'll actually do it. So the IIUM Medical Center in Kuantan implements what we talk about. I am on the Sharia board of that hospital. We meet every year 2 or 3 times to make sure that whatever we do conforms to Islamic values. And now we are looking to the future. Genetic engineering is a challenge. So we are trying to make ijtihad maqasidi to deal with the new challenges, ethical challenges. We are making ijtihad to deal with medicine as a business. As you know, medicine is business. A lot of money is involved. We want to see how we can put fiqh and mu'amalat in the business management of hospitals. We need a different business model from the models that are taking place. We also are beginning to think about going into the pharmaceutical industry, the production of drugs. How do we integrate the Islamic understanding in that area? So integration actually, as an overview, is about values. You integrate the values and then you get this Islamized medicine. It's impossible to survive as a community, as a civilization, if your development is not based on your own values. Muslims will thrive if their development in medicine or anything else is based on their values. We now can see the fruits of what has been going on for more than 20 years ago. And I think the future, inshallah, is going to be bright. And we say the sky is the limit. Now, I want to move on to talk about epistemological issues. How do we integrate the medical curriculum? First of all, using the Quran and Sunnah, we define these basic concepts. What does life mean? What does death mean? What does disease mean? What does treatment mean? See, when you go into details, these are very interesting. Like, for example, life and death. You know that when you sleep, you die. Quran talks about death in sleep. So we go deeper. What's the meaning of death? What's the meaning of life? What's the meaning of spiritual life, physical life, continuity of life? And the boundary between life and death now is also very vague, because in the ICU, the intensive care unit, we keep people there. Allah knows that they are alive or dead. So there are many, many issues that we need to clarify at a conceptual level. The issue of what is disease, because from the Islamic perspective, disease can be positive. When you get disease like Sayyidina Ayub and you have sabr, you get a reward. So we go deep about these concepts when we start teaching our students. Then when we teach them the basic medical sciences like anatomy, the structure of the body, physiology, the functions of the body, we enable them to see ayatullah or sunanullah, to see the signs of Allah subhanahu wa ta'ala in his creation. One of these signs is the issue of parity. Everything that Allah subhanahu wa ta'ala made is zawjain. You know, you have the left and right, the right heart, left heart, the right lung, the left lung. The body has got this system of parity all through. There is the concept of perfection. When we look at the human body, every part of it has got a function. Nothing is superfluous or therefore nothing. So this is the way we teach the basic medical sciences. We're integrating these Quranic concepts in the science. Then we teach them the fiqh aspects of diagnosing, preventing, and treating disease. Because some treatments are halal, some are haram, some are makruh. We want them to understand that. And then we teach them about community health. It's not enough to treat disease in the hospital if you do not go in the community to deal with the issues, the problems that cause that disease. If you're a surgeon and you are fixing bones of people who get fractured in car accidents, you will do that until you die. You need to start asking the question, Why are there car accidents? Are people drinking? Are people on drugs? Are people not careful? So you need to look beyond or outside the four walls of the hospital. So I will be talking to you about what we have done epistemologically about the curriculum of teaching community medicine. But before I do that, I want to present the thesis that Tawheed is the basis of integration. As you know, in Islam, our thought, al-Fiqh al-Islami, al-Hadar al-Islamiyya, al-Ma'rifah al-Islamiyya, they have to be integrated because Tawheed means integrating everything. This Tawheed al-Rububiyyah, the creator of everything in the universe is one. This means that everything must be integrated, must be fitting together because they have got all the same creator, all the same origin. Now, the same Islamic values, al-Qiyam al-Islamiyya, must be integrated in our practical life, in our medical practice, because this is part of integration. You cannot say that there is medicine over there because that negates the essence of Tawheed. Now, I want to end by giving you again an epistemological window on what we do with the curriculum of community health. Usually in the fourth year of the medical school, we teach students about community health programs, but the curriculum that exists really talks about community problems. We teach them how to make a community diagnosis. There are problems in the society, how to diagnose them and how to deal with them. But what we teach are the external manifestations of these problems. We teach them about, for example, wife abuse, child abuse, addictions, drug abuse. This is what we teach. But these are the external manifestations. Really what we should do, and that's what we are trying to do under the Islamic epistemological framework, is to teach them about establishing a good community, qaryatan tayyiba. What are the values? What are the components of this qarya tayyiba? Because this is what they need to know. Once they know this, then they can see the deviations. You cannot start with the problems without teaching them what should be the normal. For example, we have a lot of addiction. Addiction to everything. Addiction to football, addiction to alcohol, addiction to drugs, addiction to the internet. See, a lot of addictions in the society. But you cannot deal with them if you do not remove the root causes. Why do people become addicted to things? So that's why we want to change the curriculum from starting with the problems to basic paradigms in the society itself. Unfortunately, modern medical curriculums are based on paradigms that we get, most of them from the West, from a different worldview, not the Islamic worldview. So we want to teach community health by adopting the Islamic worldview in the basic paradigms. Take the issue of gender. From the Western perspective, the talk is about gender differences and emphasizing gender differences, trying to remove gender differences. They shouldn't exist. But the Islamic point of view is different. In fact, Islam says gender should be different. Men should have a male identity. Women should have a female identity, because this is the best of the family. Why should I marry a woman who is like me? I want to marry someone who has got competencies, who has got emotions, who has got characteristics I do not have, so we can make a pair. So our approach is actually to emphasize gender identity and gender difference, because that's how we are going to build the family. It's for that reason that even dressing, we want males to dress in a different way from females, because we want to emphasize this gender identity. In the hospitals now, we make different uniforms for male doctors and female doctors. Part of this paradigm. We are not there to remove differences between the genders, no, because they are good. But we are there to learn how to use what one gender has and the other doesn't have, so that they can get together and form a pair that complements one another. We teach the students about the family. We see the family is the microcosm of the society. In fact, a lot of people start talking about applying Sharia in the society. No, talk about applying Sharia in the family. Because if you apply it in the family, finished, you have applied it in the whole society. Because this is the natural social unit. And we need to preserve it as a basic unit of society. Now, marriage, again, we teach them the deeper meaning of marriage. It is the start of family formation. It's the start of making the nucleus of the society. We teach them about Silatul Rahm, parents and relatives. These are part of the family. Why do you run to a psychologist when you have got a problem, when you could have gone to your grandfather and your grandmother, the extended family? So this, if we follow this Islamic approach, many community social problems will disappear. We also want to teach the doctors to understand that the community has got institutions that needs to be strengthened. The masjid is the center of the community. That's where people meet. We teach them the concept of ukhuwa in its deepest meaning, that all people are brothers and sisters, and that their duties, obligations of ukhuwa that we have to fulfill. We teach them the concept of takaful, mutual self-help. We can help one another. We teach them the concept of shura. It has to be applied at the family level and the community level. And also we talk about mal, the economic system, because the economy determines a lot of things and the economy causes a lot of problems. So these are things that a doctor should understand from the Islamic perspective before he goes on to look at the problems. There are lifestyle problems. See, the problem is that we copy many lifestyles, many of them not compatible with our religion, our civilization. We have got sexual perversions that are spread and encouraged by the mass media. We have a lot of addictions. And then, because of these problems, poverty comes in. Because as the poverty comes when al-qarya, the village, the community is no longer good. As long as the community is following the rules and is good, poverty will go away. And violence, of course, comes after poverty. So with this progression, we start with what should be the normal community. And then once we know what the normal is, then we can easily understand what's abnormal. This is the reverse of curriculums of community health in many medical schools that start with the problems. If you start with the problems, you will never solve them because you don't have a model of what is normal. We don't stop there. We also teach the doctors that don't solve problems in the hospital. You need to do da'wah. You need to spread ideas. You need to know how to spread the values of Islam. You need to know how to do nahi and amr bil ma'ruf wa nahy al munkar. You need to play a role in society. You need to work on changing the society. تغيير الاجتماعي. إن الله لا يغير ما بقوم حتى يغيروا ما بأنفسهم. Social change starts with us. So the doctor should be aware that many diseases that we have their origins in the society. So if you want to deal with them, you need to start with the society. I'll give you a simple example. Right now, diabetes is a major problem. Many people are suffering from diabetes. we've got heart disease, we've got obesity. Now, all of these problems start in the society. These are called the metabolic syndrome. These diseases have to do with the way we eat. The Prophet told us to feed 1/3 of the stomach for food, 1/3 for water, 1/3 empty. And also he taught us that we cannot eat and be satisfied. نحن قوم لا نجوع نحن قوم لا نأكل حتى نجوع وإذا أكلنا فلا شبعنا. We do not eat until we are hungry. But then when we eat, we do not get full. It means we don't fill up the stomach. The problem of modern society is we are eating more than we should eat, and then we don't have enough activity. So a doctor who looks at diabetes, at blood pressure as a hospital problem to be treated with drugs will not be very successful. That's why in this integration of Islamic values, we are trying to put values in the curriculum that will produce a different type of doctor, and this doctor will practice medicine in a different way and a different society. So inshallah, I will stop here. Thank you very much for listening to me. وجزاكم كل خير.
Alhamdulillah Rabbil Alameen. Thank you very much, Prof, for that sweet and short summary of the wonderful, great work that is done in the integration of medicine. And clearly, for my colleagues in the Faculty of Education, you can see that there is a very clear connection and link between the work done in integration of medicine and what we are doing in the Faculty of Education. We have a lot to learn from what the medical people under the leadership of Professor Omar Kasule have achieved in this area. Alhamdulillah, as I said, this is Khitam Misk, is the best conclusion of whatever we have deliberated upon in this conference. We are fortunate that Prof has been gracious enough to leave us with about 20 minutes time for deliberation. So we'll entertain questions. If you have any questions, any comments, any remarks upon what Professor has said, please, you are welcome.
Assalamu alaikum.
Wa alaikum salam wa rahmatullah. Yes.
So can I ask a question?
Yes, please.
Okay, thank you very much, Prof. Omar, for your presentation. I am Dr. Muhammad Yusuf from Kuliah of Allied Sciences. And I was really astonished with the presentation, and I really like especially the 5 things that you mentioned in terms of the education in medicine, because I'm teaching in Allied of Sciences, especially in anatomy and physiology. And I did present it to you last time on the IIT occasion on the design errors pertaining to anatomy. So my question is that, since we know that in teaching of anatomy and physiology requires us to integrate the greatness of Allah in certain of the creation, that is fine. But currently, the issue of human evolution has struck in terms of medicine, whereby there are certain structures always be related to human evolution. For example, there are certain structures was there in animals but absent to us, or were absent in the animals but were there in us based on comparative anatomy. So my simple question is that, in your view, how do we view human evolution in the teaching of medicine?
Allah Jazakallah khair. Thank you very much for this question, because it brings up major conceptual issues. Evolution as a theory is a theory. It's not a fact, it's a theory. And my problem is not with the theory of evolution. My problem is what is behind the theory of evolution. Behind the theory of evolution is atheism, the denial that there is a creator who fashions us, you know, who created the cats, the dogs, the monkeys, and the humans. That's the underlying message, but they don't tell you that message. You know, the theory of natural selection underlying evolution is an atheistic theory. It says the world does not need a creator. In other words, it can create itself. But then someone asks, how come that there are so many shapes of humans, so many shapes of animals, so many shapes of snakes and plants, you know? How does this occur? For me, it's very easy. There is one creator who created everything in the different ways that he wanted to create them. That's my approach. But they need to have a theory to remove this creator from the equation. They say, okay, it's evolution. It was something, simple cell that kept on changing, became plants, became animals, became snakes, became monkeys, became humans. So we need to focus on the atheism that's behind the theory of evolution. If Allah wanted evolution to occur, he could have done it. Kun fayakun. Allah could have told a monkey to become a human. Why not? He can do that. So that's not the issue. The issue is what is hidden and it's not told to us, the atheism, the denial of the presence of a creator for the universe. And I think this is what we need to emphasize. Now, just 2 minutes, I'm taking too long, but it's a very important thing. When you look around in Malaysia, we have got many cars. Protons, I now no longer even remember the types of protons we have. I remember Proton Saga, but there is Proton Wira, and there are many others. When you look at these protons, different models, there is something similar about them, but also they are different ones. To me, it tells me the maker is one. The factory and the engineer is one who made these different cars and made them different. I cannot say that the maker first made the Proton Saga and then Proton Saga by chance. This is what they say, this is what natural selection says, that by chance, Proton Saga became Proton Wira. Every one of us knows that's a stupid thing. But when it comes to the human body, somehow we accept this understanding. So please understand the theory of evolution as a theory which tries to explain the diversity in creation. That's the approach, it's a theory. And we have got a different approach that the diversity and also similarity between living creatures testify that there is one creator for all of them. But we don't want to take their theory at face value because we know it's not the theory that's important. It is the atheism that's behind it.
Okay, thank you very much, Prof, for the profound answer, and thanks, Dr. Muhammad Yusuf, for raising this very, very pertinent question. Now, we have a question in the chat box from Kajowa Abdurrahim. Existing policies in social constructions don't support medical decision-making, which affects medical care outcome based on faith. How best can this be solved? Prof, I guess it is clear. Yes.
Yeah, this one is my relative. Okay.
Yes.
Now, you see, we teach the doctors to develop a different paradigm of understanding disease and its treatment. There is an atheistic secular paradigm which looks at disease treatment purely in the physical sense. If you tell somebody that, okay, you have got a disease, make dua, they laugh at you. Okay, now, this is what we teach. When you have got a disease, you use all available tools. You can do surgery, you can use a drug, also you can make dua. But to the people who think that dua is just dua, it's ineffective in treating physical diseases, medical evidence is against them. Because all of us know that when you have got a severe disease and you make tawakkal ala Allah, you relax. your mind relaxes. So when your mind relaxes, because you know Allah will take care of that, the function of your nervous system, the function of your immune system, the hormones that fight disease, functions better when you are relaxed. Your immune system is more effective when you have got this relaxation. So dua actually can treat disease directly in a physical way using the neurohumoral axis. So this is what we teach the doctors to understand, that dua is an integral part of treating disease. But even the secular people, they use music to treat some diseases because it relaxes the mind. What about reading Quran? The mind relaxes and your body systems work better. Your immune system works better. So we teach the doctors, and using actual physical medical evidence, to understand this integration of all methods of treatment into medicine, so that they can also advise their patients.
Thank you very much, Prof. Brothers and sisters, do we have any more questions?
Assalamu alaikum.
Wa alaikum salam. Yes, Prof. Habib.
Assalamu alaikum, Brother Professor Omar Kasule. Thank you for the enlightening and encouraging integration of knowledge in medicine. I remember in the 2008, when we started the integration program in Indonesia, I asked you why we start with the medicine. You mentioned that the easiest way of integrating knowledge is medicine. Now I know better, but I still questioning about the why we should integrate first from the medicine and then followed by the other disciplines like economics and psychology, and now we come to the social science and so on and so forth. But one thing that aside from the technical things, yeah, we have some impact, yeah, from the good impact from the integration of knowledge is the what we call inspirational impact of the program. Last year, 2 years ago, before the COVID, the MUKISI, the Majelis Upaya Kesehatan Islam Seluruh Indonesia, chaired by Dr. Masyudi, the chair, the director of the hospital of the Islamic University of Semarang. We met also Dr. Arif Usman, yeah, from the IUM, and Dr. Agus Sukocho, the director of Islamic Hospital in East Kalimantan, and also Dr. Rukanta. I think you remember him, yeah, from the Unisba, the chair, the director of the Islamic Hospital in Bandung. The MUKISI organized the international exposition of the Islamic hospitals, including certainly the Islamic hospitals in Indonesia. So it's encouraged the development of the Islamic hospitals. I think this year, many Islamic hospitals has been developing in Indonesia, and especially in East Central Java, by Universitas Islam Indonesia. And this year, this coming October, there will be another exposition, international exposition of Islamic hospitals to be held in Yogyakarta, coordinated by Dr. Widodo from Universitas Islam Indonesia. And since last 3 years, that's what I would like to mention to you, Professor Omar Kasule, that from your visits, from your sessions on the integration of knowledge, there have been new universities, what do you call, Islamic medical science based, Islamic medical science based, like the University of Muhammadiyah in East Kalimantan, the newly established Universitas Muhammadiyah in Bandung, and also 3 Asia universities. Asia universities is organized by the Asia Organization of Muhammadiyah. They have 3 hospitals, they have 3 universities based on Islamic medical science. So what I would like to share with you that aside from the technical integration of knowledge or epistemological base, but there are newly universities based on medical science. That's because of your presence. That's because of your integration of knowledge. So integration of knowledge not only touch the technical or philosophical, but also inspirational, even to develop new hospitals and also to develop the universities based on medical science. That I would like to thank you very much for your presence in 2008 in Indonesia. Assalamualaikum warahmatullahi wabarakatuh.
Walaikum assalam wa rahmatullahi wa barakatuh.
Alhamdulillah. Yeah, a little bit of a comment. Pak Habib is raising a big issue. Why do we do it in medicine and so easily and quickly, and we don't do it in psychology or sociology? You know, this is a very pertinent question. I'm going to say something. I don't think any one of you will agree with me, but I have to say it. Medicine is an easy discipline. You see, psychology is very difficult. Sociology is very difficult. Education is very difficult because the social sciences have got many concepts that are vague and too many and vague and so many branches. Social sciences are dealing with the human being. The human being, as you know, is very complex. Even a small child, if you take the psychology of a small child, you can write 20 books. A small child has got very complicated psychology and sociology, the man, the woman. So social sciences, because they are based on the human, they are very complicated, very extensive, very difficult. Islamizing them is a bigger task than medicine, because medicine has got few paradigms, few concepts, and the methodology is very clear. So you Islamize the methodology and put in ethics, put in values, and then you can reach it. There is one mistake that many parents commit and many educationists commit. When students finish high school, those with the highest marks are sent to medicine. And those with the lower marks are sent to the social sciences. This is why our ummah has many weaknesses today. We should do the opposite. The brightest should go into sociology, psychology, journalism, for example. The people who run our television stations, who run our schools, who run our counseling, these are the people who actually control society. We should put our best students there. But we are doing the opposite. So medicine is limited in terms of its concepts, methodologies. So it's easy to Islamize, it's easy to integrate. And as you have seen, it has been done in practice. And also many other scientific technology-based disciplines, you will see that they will become integrated faster than social sciences, because basically social sciences are very difficult subjects, require very bright people to do them.
Thank you very much, Habib and Prof, for that clarification. It is really eye-opening. We have a question. Okay, this is from Siddiq Ahmed. I guess there is a language issue. The question is not really clear to me. But Siddiq is saying that
I can see his question.
Yes.
roughly what he wants to say is, why do you go to medicine? هو الذي وإذا مرضت فهو يشفيني. It's Allah who gives shifa. Why do you bother to go to the hospital? This is a very serious issue about qadar. And I take this opportunity to clarify. There are two things, al-qada wal-qadar. Unfortunately, we mentioned qada before we mention qadar. It's better to start with qadar and then we mention qada. Qadar means Allah subhanahu wa ta'ala qaddara kulla shay. Allah subhanahu wa ta'ala already planned everything. What will happen, he knows. It's all planned. But we as human beings, we do not know what Allah planned. So we have to make the best effort to get the best result. If you are sick, you go to the hospital. And you ask Allah to get cured. Dua and effort make a difference, because la yughayyiru al-qadr illa dua. Allah's qadr cannot be changed except by dua. If you make a dua, the qadr can change. So you go to the doctor doesn't cure you. The doctor tries, but the one who cures you is Allah subhanahu wa ta'ala. So when we're in the stage of qadr, as humans, we don't know what is Allah's qadr. We make all efforts. We go to the hospital, we make dua, we rest, and then the stage of qada, that's when the result comes. Allah decides something, that somebody dies. When qada comes, we accept. We do not question qada. Allah subhanahu wa ta'ala, whatever he decides is what we accept. So seeking treatment is not against qadar. As a human being, you are required to try everything that you can do in the knowledge that in the end, it's what Allah wants is what will happen. But Allah's qadar can come through your effort. Your effort with the dua, the qadar of Allah subhanahu wa ta'ala can be positive and you get cured. Yeah.
Okay, thank you very much, Prof. Brothers and sisters, I want to give myself permission to ask one question, Prof.
Yes.
You see, we are living in a world which is dominated by UN institutions, especially our third world countries. When you want to make a curriculum, you want to change anything, we are beholden to institutions like UNICEF, UNESCO. They are the ones who tell us what to do. And in the recent, the past 2 years of the pandemic, we have seen WHO telling people how to deal with disease, how to manage it, what protocol to use. Now, how do we navigate this geopolitical system when we want to Islamize and get rid of the Western paradigm? Thank you, Prof.
Yeah, Jazakallah kulla khair. First of all, we are not about getting rid of the Western paradigm, okay? What we want is that everybody should know that there are many paradigms in the world. So there's the Islamic paradigm, the Hindu paradigm, there is the Western, but then the Western paradigm is a European secular paradigm whose origins are the Roman and Greek civilizations. But we don't want to go into those details. So all we want to say is that whatever is going to be done at the international level should respect the diversity and multiplicity of paradigms and worldviews that are in the world. What's wrong today is that it's only one worldview that is being presented. It's the Western or European secular worldview. Of course, the people who have got that worldview have technology, they have the media, so they dominate. But we as Muslims, we say, no, we also have got our worldview. And we want it to also to be in the supermarket of ideas. But we'll start with ourselves. We'll start by integrating our worldview, our values in our disciplines of knowledge, our universities, our hospitals. And then when the rest of the world sees that our worldview also has got good results, maybe they will listen. So we need to have balance. At the moment, all ideas flow from one worldview. The other worldviews are marginalized. The duty of Muslim intellectuals is to make sure that the Quranic paradigm as a worldview is also expressed. At the moment, I don't think we are doing enough to express it. We need to do more. We need to write more, discuss more, speak more. Inshallah, with time, this Quranic worldview will also come to be known. And what I think, because I believe it is a superior worldview, if we present it very well, you never know. The rest of the world may follow it.
Thank you, Prof. There is another question in the chat box.
Why did Muslims not produce their own COVID vaccine? What's wrong with the medical faculties of the Muslim world? This is very easy to answer. Okay, and I think the Kuli of education, they people have to answer this question. You see, our education systems until now, and except with very few exceptions, they teach people to memorize, to accumulate information. They don't teach them to analyze information. They don't teach them to go beyond the information they get. They don't teach them to think out of the box. In the Western countries, they encourage people to analyze, to think, to ask questions. So I think, don't blame anybody for our weaknesses in science. We just need to change the way we teach. Not only science, also they will teach the Quran. They will teach hadith. They will teach culture. We need to develop young minds that think in an original way, that ask original questions, that are inquisitive, that think out of the box, that question things. When this starts, inshallah, we'll start discovering a lot of science and a lot of technology, and we'll make many vaccines. But before we change the education system, it's going to be very difficult. And to change the education system, we don't have to look for ideas from outside. We need to look at the methodology of the Prophet ﷺ, how he taught his companions, how he encouraged them to ask questions, how he challenged them, how he made them think, how he made them solve problems. We need to look at the way the Quran was revealed. As you know, no verse was revealed before there was an event, Sabun Nuzul, so that people can relate the Quran to a real problem, this problem-based learning. So we need to do something about the education system. That's the key. If we do not change it, we shall continue to be intellectually dependent and technologically dependent on the West.
Okay, thank you very much, Prof, for this wonderful presentation, eye-opening for us in the faculties of education. We really have learned a lot, and I wish, I pray that my colleagues in the Faculty of Education could pick a leaf from what the medical faculty has done. Of course, taking into consideration the fact that you have mentioned that education and social sciences are much more complicated than medicine. But I hope we can really learn from what you have achieved in the faculties of education. We really appreciate, and we are honored and blessed that you accepted our invitation. May Allah bless you always. So brothers and sisters, now we are heading to the, we have finished the keynote, the fourth keynote presentation, and we are heading to the concluding session or the closing ceremony of the conference. Professors, allow me to start the proceedings of the conclusion, inshallah. Okay, so it's going to be very brief. Basically what we have, is that we have deliberated over 2 days. We had important keynote addresses from among the great Muslim minds in the areas of Islamization. We have listened starting from the first day. We listened to the wonderful views summarizing the current achievement of Islamization and integration of knowledge, especially at IIUM, from the rector of IIUM, Professor Emeritus Tan Sri Dr. Zulkifli Abdul Razak. We listened to the integrative ideas of Professor Emeritus Dr. Osman Bakar. We also had integrative Quranic worldview from Professor Muhammad Hasan Biraima, and we had experiences of integration from the field by Professor Hamid Fahmi Zarkashi on the Gontor experience. We listened to integration of knowledge in the physical sciences by Professor Dr. Warid Fikri Faris, and works Associate Professor Dr. Fathi Malkawi dealt with the question of where are we on IOK, and he was looking at the recent past and the near future, where we have been and where we are going. Professor Abdul Aziz Bargus looked at the integrated educational framework. Prof. Dr. Jamil Osman looked at the development and managing of programs of integration of knowledge at Islamic higher institutions. And finally, and as I said, this is Khitam Misk, which has put everything together for us. That is integration of knowledge in medicine by Professor Dr. Omar Hasan Kasule. Now, we wouldn't have expected medicine to be really connected with education, but everything as we see it is about integration, and we have really learned so much from this last presentation by Professor Kasule. And we thank all our great presenters for the wonderful, insightful remarks, and I hope this is going to shape our agenda for the years to come as far as integration of knowledge is concerned in the field of education. We know we have a lot of work to do. It is challenging. The world is becoming more complicated after the COVID pandemic. But as always, and what we see, the achievements of the medical people, we can actually, with efforts, with determination, with perseverance, we will, inshallah, be able to achieve some breakthroughs in the areas of education. Now, with this, we come to the concluding part of the conference, and the committee has put together, has elected people who have made excellent presentations in the breakout sessions. We have best papers, and I'm given the honor to announce them. Just give me a minute to share with you the PowerPoint presentation with the names of the winners. One moment. Okay, thank you very much. So we have the award winners.
Dr. Siraji, may you mention the category, please?
Yes.
May you mention the category for this best paper award?
Okay, pardon, I cannot, the voice is not really clear.
Again, may you state about the category? This award because we have certain category. Can you see on the share?
Yes, Dr. Ikram, could you repeat again?
Doctor, may you read the category of the paper award? We have mentioned about the category, yeah.
Okay, sure. I'm going to read. So, Best Paper Award, we have non-student category. The winner is Dr. Ikram. Okay, the winner, we have the Best Paper Award for this non-student category, Marsni Muhammad Mokhtar, Afnita, Fazila, Abdurrahman Malni Jamir, and Efrianto, and that is their paper. So that is the Best Paper Award. Congratulations. Now the Best Paper Award for student category is Masdi Nizam bin Shamsuddin Shukur. Thank you very much. Congratulations. And the best presentation for non-student category is Muhammad Ikram bin Abu Hasan. Congratulations, Dr. Ikram. And the best presentation award for student category is Nurul Ashikin Izhar. Congratulations. So thank you very much. That ends the announcement of the winners of the awards. And finally, before we conclude, we have prepared a short video to highlight whatever we have achieved in this conference. So I leave it to the technical committee to show the video. Thank you.
Of our initiative shaping ideas and practices in higher education. However, his
in this university, the International Islamic University, in trying to understand what integration of knowledge.
The aim of our two-day conference, among others, are to discuss and enhance understanding of the Islamic paradigm, provide a platform.
Welcome to the second plenary session. My name is Muhammad Burhan Ibrahim, and I have been given the amanah to moderate this session, inshallah.
Jatra, and very good morning. In this wonderful Wednesday, we would like to welcome all of you again to this international conference on the
you very much. Once again, we thank our distinguished speakers for the wonderful contributions, wonderful presentation. We thank all participants, presenters. We thank the organizing committee for the work well done. And we end this conference by reciting Surah Al-Asr and Tasbih Al-Kifara. Barakallahu fikum wa salam alaikum wa rahmatullahi wa barakatuh. Assalamu alaikum. Fi amanillah. Salam.